Partners in crime.
Happy New Year. This first Board of Supervisors meeting for 2022 is called to order. If you'll all rise and join me for an invocation from Reverend Griff Vaudier.
For a minute, I thought we were going on to Mr. Rogers or something.
Yes, but no sound on my end.
Sovereign Lord God of the universe, we are truly grateful for the wisdom, discernment, and guidance that you have imparted to the Mojave Board of Supervisors throughout our previous year of 2021. We are grateful that you have enabled Mojave County's ship of state to successfully navigate the shoals and reefs of circumstance and compromise up to the present hour. We declare our trust and faith in you and your leading of our elected officials throughout the coming year of 2022. May peace, courtesy, and goodwill characterize all proceedings, and that the discussion of all the items on the docket, whatever time that the supervisors gather, may be in decency and in order. May your blessing and divine insight be with each and every supervisor as they deliberate the actions that so strongly affect the future welfare of Mojave County citizens. We ask these things in the name of Jesus Christ. Amen.
Amen. Thank you, sir. Please join me in the salute to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. The Board of Supervisors may by motion recess into executive session to receive legal advice from the board's attorney on any item contained in this agenda pursuant to ARS 38-431.03A 3, 4, and 7. Motion and action to call for an executive session to be held on January 18th at 2022 at 9 a.m. for discussion and consultation with legal counsel in accordance with ARS 38-431.03A 3, 4, and 7.
So moved.
Second.
All those in favor say aye.
Aye.
Those opposed say nay. Ayes appear to have it. Official business before the board. Committee or legislative reports. Supervisor Bishop.
Not much to report other than this morning I attended the ACO LPC meeting representing CSA in Mojave County.
Thank you, Supervisor. Supervisor Angus.
Nothing this morning, thank you.
Supervisor Langenfelter.
Thank you, Chairman Gould. This legislative session for the Arizona legislature starts on the 10th. As those of you know, Mojave County has been in the middle of a lot of the water legislation. I'll actually be going down this Friday to put the finishing touches. I'm part of a group that's putting together the RMA legislation, working with Representative Cobb. This is the session to get something passed regarding creation of new rural management area legislation, and also hopefully either prohibition or some sort of limits on future fourth priority water transfers off the Colorado River. Thank you.
Thank you, Supervisor. Supervisor Johnson.
Nothing, Mr. Chair.
Thank you, Supervisor. County Manager report. Do we have an acting County Manager report?
Chairman, there's no report this morning. Thank you.
Thank you, ma'am. Approval of the October 4th and December 6th, 2021 Board of Supervisor meeting minutes. Looking for a motion.
Motion to approve.
Second.
You've heard that motion. All those in favor say aye.
Aye.
Those opposed say nay. The ayes appear to have it. Call to the public. Penny Pugh with Representative Gosar's office.
Good morning, Chairman Gould, members of the board. Appreciate the minute. Want to bring a Happy New Year, a much better 2022 for all of us, and a reminder that the Congressman continues to work and try and get things passed in a very contentious time that we are all in right now, as we all are aware. Reminder that it is possible to meet with our staff if you have problems with federal agencies, VA, Social Security, FAA, whatever it might be, FEMA funding, as it comes down to help with some of the COVID relief. Please give us a call. We will accommodate and do as much as we can do to try and help that. And just want to leave God's wishes with Mojave County, and God bless Arizona, and God bless this United States. Thank you.
Thank you, ma'am. Stephen Lee.
Stephen Lee, Bullhead City. This is my first time before this board. I think Hildy's the only one that knows me. I just wanted to talk in general about freedom. Our freedoms are under attack. Our freedoms are under attack by the federal government, corporations, and I think that the County Board of Supervisors needs to do everything within its power to make sure that our freedoms are upheld and not attacked further. And this includes things that could mortgage our freedoms, taking money that comes with any kind of strings from the federal government. I think that as a county, we need to be as self-sufficient as possible and make sure that we maintain the freedom of our citizens. I think this includes our sheriff being the highest law enforcement officer in the land, if necessary, ordering any federal or even state officials that are operating outside the Constitution here in our county to leave. I thank you very much for listening, and I hope that we can all have the highest level of freedom that our founding fathers intended that we have and keep. Thank you very much.
Thank you, sir. Jeff Esposito.
Good morning. This is a statement from Archbishop Vagano. He's 80 years old. Dear American people, dear friends, for 2 years now, a global coup has been carried out all over the world, planned for some time by an elite group of conspirators enslaved to the interests of international high finance. This coup was made possible by an emergency pandemic that is based on the premise of a virus that has a mortality rate almost analogous to that of any other seasonal flu virus. On the legitimization and prohibition of effective treatments, and on the distribution of an experimental gene serum, which is obviously ineffective and which also clearly carries with it the danger of serious and even lethal side effects. We all know how much mainstream media has contributed to supporting the insane pandemic narrative. The interests that are at stake and the goals of these groups of power, reducing the world population, making those who survive chronically ill, and imposing forms of control that violate the fundamental rights and natural liberties of citizens. And yet, 2 years after this grotesque farce started, which has claimed more victims than a war and destroyed the social fabric, national economies, and the very foundation of the rule of law, nothing has changed in the policies of nations and the response to the so-called pandemic. Last year, when many still had not yet understood the gravity of the looming threat, I was among the first to denounce this coup, and I was promptly singled out as a conspiracy theorist. Today, more and more people are opening their eyes and beginning to understand that the emergency pandemic and the ecological emergency are a part of a criminal plan hatched by the World Economic Forum, the UN, WHO, and a galaxy of organizations and foundations that are ideologically characterized as clearly anti-human, and, this needs to be said, clearly anti-Christian. One of the elements that unequivocally confirm the criminal nature of the Great Reset is the perfect synchrony with which all these different nations are acting, demonstrating the existence of a single script under a single direction. And it is disconcerting to see how the lack of treatment, the deliberately wrong treatments that here have been given in order to cause more deaths, the decision to impose lockdowns and masks, the conspiratorial silence about the adverse effects of so-called vaccines that are in fact gene serums, and the continuous repetition of culpable errors have all been possible thanks to the complicity of those who govern and the institutions. Political and religious leaders, representative people, scientists, and doctors, journalists, and those who work in the media have literally betrayed their people, their laws, their constitution, and the most basic ethical principles. How is it possible to arrive at such a betrayal? How have we come to be considered enemies by those who govern us, not in support of the common good, but rather to feed the hellish machine of death and slavery?
Thank you, sir. Dale Dennis.
Hello. Hi, it's nice to come before all of you. I just want to throw out there with the hospital things. The error of their ways is when they chose to go pharmakia, where medicines became their god. And we're seeing the fruit of that with all the death and destruction that's happening to the citizens here and throughout the nation, actually throughout the world. I just want to encourage them to get back to what they're supposed to do. Be helpful, do no harm. I think the doctors are going to have a world of hurt ahead of them because of the choices they've made with the drugs that they've pushed. I've had secondhand experience with it. The local hospital in Havasu almost tried to kill a friend of mine using, however you say it, remdesivir. It's not a good situation. And throwing more cash at them, they don't deserve it. Through the years, I'm older, and so I know that cities, local governments launder money through boards of education, through water boards, and now hospitals. So just be smart. Be wise about where you put our dollars. 27% of my tax bill this year or last year is going to education, and I wouldn't put a child in public education, but here I am, gun to my head, going to pay it. I don't know how much I throw at the hospital, but I'm sure I throw something. So anyway, I just want to encourage you. Jesus was never nice. Jesus was always kind. The reason he was never nice? Nice lies. Republicans, conservatives, we've got to stop being nice, and we've got to stand for the truth. We've got to stand for who God made us and what we're naturally endowed with. So I just want to encourage y'all with that. Thank you very much.
Thank you, ma'am. Jennifer Esposito. I saw that.
Jennifer Esposito, Kingman. Glad to see a chairman who knows Robert's rules and has been a parliamentarian. Hopefully things will go smoother in 2022, and Happy New Year to you both. Because it's 2022, I feel compelled to revisit something I told you last summer. So I'm going to go to the website for the Center for Disinformation Creation, the CDC. And I'm going to read you something that they posted on 7/21/21, which says, after December 31st, 2021, CDC will withdraw the request to the U.S. Food and Drug Administration for emergency use authorization of the CDC 2019 novel coronavirus real-time RT-PCR diagnostic panel. Okay, that's important because I told you months ago that it wasn't testing for the coronavirus, and the virus had never been isolated according to information requests in Canada, Italy, and other countries. No one can find where the virus was ever isolated. And what's interesting, if you had read farther down that CDC website, it says, CDC encourages laboratories to consider adoption of a multiplex method that can facilitate detection and differentiation of SARS-CoV-2 and influenza viruses. Okay? Differentiate between COVID and the flu. Wait, what? The tests weren't differentiating between COVID and the flu? I can't imagine why we had no flu cases last year. All right? Now, the part that's also important about that with the PCR test is, as I said, the fraudulent PCR test only looks for a lab primer, which is a pre-programmed range of genetic code ranging from 30 to 280 base pairs. But a real coronavirus has 30,000 base pairs. And the current test only looks for the snippets it wants, and the computer program fills in the blanks. So, since I've been on this for months now, and we're into 2022, and because the so-called Department of Public Health relies solely on the PCR test reports, and whereas you have said in the past that you should probably have a disclaimer against CDC guidelines, which are not law or anything, I'm suggesting for 2022 that your New Year's resolution be to issue a public apology for 2 years worth of fraud and put some kind of disclaimer on every single one of those so-called fact sheets that comes out now twice a week. Thank you for reducing that, because you don't have a single actual legitimate case. So again, Happy New Year, and don't believe anything based on PCR. Make a plan on how you're going to do this moving forward. Thank you.
Thank you, ma'am. Scotty McClure.
I got a correspondence from a new person you hired for the TV district, and I'm pissed. So I will take this up next month. Kroger's ending COVID-19 benefits for unvaccinated staff. I think you ought to cut off, if they end up in the hospital on my dime, my tax dollar, I shouldn't have to pay it. You need to cut off all federal, state, city, federal. 200 Marines were kicked out of the service because they refused their vaccinations. We need to get serious. Either protect yourself with a damn shot, unless you got a health problem. I got no problem with that being excused. They can work from home. Find them a job, okay? No excuse. But I just, in my life, when I was in the service in the 60s, you stood in line every Saturday and you got shots in each arm. But I guess it's a constitutional right. Bullshit! I would have ended up in Fort Leavenworth. When are we going to do something about these clowns in Phoenix, the cyber ninjas? Why won't they release the... Oh, don't let me swear again. You don't need to know about that one. It's about our death toll. This is a week or two ago. Reached 1,000 in this county alone. Under your watch. Under your watch. Now, this is for the next stuff is for the doctors and stuff, whatever. I'll be back. But you got to do something. I'm tired of this crap. This is the second year. We're going into our third year come March, I guess it is. Oh, no, I've lost track. I live part-time in California, and I can't go home because it's even worse there.
Thank you, sir. Regina Wanesco. Oh.
Thank you for your time today. Take my mask off. Before I present my findings to the board, I would first like to point out that one of the handout materials I gave you is of most importance in these discussions. The final interim rule, how this document affects the disbursement of the American Rescue Plan Act, is the subject of my presentation. Hopefully you have all read this document previous to the decisions on how you earmark funds to your district. I'm here to respectfully ask the board to discuss and call to a vote whether to send a letter to the State Attorney General asking his opinion regarding the possible mismanagement of American Rescue Plan Act funding. Please keep in mind that on October 13, 2010, the Plain Writing Act was signed into law by President Obama. This was created to summarize complicated legislation into language that anyone can understand. These writings hold the same legal authority as the original legislation. It is perfectly fine to refer to this document rather than the original bill. The final interim rule is one of these documents in plain language. It is the final clarification handed down by the United States Treasury dealing with the American Rescue Plan Act. All counties who applied for ARPA funds on the U.S. Treasury website must read this document because it is as legally binding as the originally written law. To be held accountable and to understand it does not necessarily require an attorney of any kind. You simply must read it and adhere to the limitations of expenditures. County Treasurer Cindy Landa-Cox would have been the authority at the time that the following possible violations occurred, and it would have been her responsibility to make sure you all have read this. To be clear, I'm not here to talk about what funding can be used on. I'm here to talk about what you cannot use the funding for. The final interim rule states, in addition, Congress clarified two types of uses which do not fall within these four categories. Section 602C2B and 603C2 provide that these eligible uses do not include, and thus funds may not be used for, depositing funds into any pension fund. The first question you must ask yourselves is, has our use of the American Rescue Plan Act paid into a pension fund of any kind? Section 602C2A also provides for states and territories that eligible uses do not include directly or indirectly offsetting a reduction in the net tax revenue of the state or territory. The county budget is made up of net tax revenue and the spending that results from those collections. Which brings us to our second question, ARPA funding being used in the place of county spending now or in the future. And the last part, I'm sorry, I was asked to be here to present this.
Thank you, ma'am. You only get 3 minutes.
May I ask the board for more time to complete this presentation? It is almost complete.
How much longer do you think it will take?
1.5 minutes, sir.
Sure.
Thank you very much. Therefore, I see that these 3 violations have occurred. 1, pension violation contributing to a pension fund and also an offset violation. A $1 wage increase for county employees over a 2-year period totaling $4 million as they are in a pay-as-you-go pension plan. Additionally, these wage allocations are made from the county's standard budget spending, creating an offset violation when ARPA funds were used instead. 2 and 3, offset violations, District 2 programs that are clearly under the jurisdiction of tax revenue, instead used ARPA funding. Davis Camp received $2.15 million offsetting tax revenue designated for the park. $650,000 for the Gary Keith Performing Arts was in violation as this project was already designated for county funding in the future. These violations resulted in a total of $6.8 million of mismanaged federal aid. There is a responsibility that comes with the knowledge that possible errors have occurred. I provided all of you with a copy of the final interim rule to refer to in your deliberations. It is important to remember that this funding was to assist everyone for the challenges resulting from the COVID-19 pandemic. Please consider sending a letter to the state's Attorney General for his opinion in this matter. Thank you for your time.
Thank you, ma'am. Okay. I'm going to move item 43 up. Supervisor Langenfelter, did you want to talk to the hospital officials first and then the public, or do you have a preference?
The public can probably go first.
Okay. We'll go ahead and take testimony from the public then. Jeff Esposito.
I don't even know how you guys came to listen to these hospital creatures and put something ridiculous on the agenda. What is this going to accomplish? This is a nonprofit corporation that they're nonprofit because they keep buying land and buildings. $50 million so far, according to our assessor's office. And what are they paying in property taxes? Probably almost nothing. They also have a membership in the HPSA, which is a health professional shortage area by the federal government, which gives them Medicare bonuses, grants, J-1 visa waiver for recruits, higher customary Medicare fees for new physicians, opportunity for setting up rural health clinics and community health centers, state and federal student loan repayments. They also get, Arizona State Primary Care Provider Loan Repayment Program. They get $65,000 for a 2-year commitment. It's ridiculous. These people have created their own problem through mismanagement and creating a hostile work environment by putting ridiculous COVID mandates on you. And face masks? Come on, face masks. Does your underwear hold your fart in? No, it doesn't. Why don't we also make an issue for global warming? How about pedophilia? That's a big problem. Why don't we, as a county, put something out for that? How about inflation? How about a myriad of problems that we should not be messing with? Happy New Year. And oh, by the way, thank you, Ron Gould. I'm glad to see all the COVID paraphernalia down, and that we don't have someone that's batshit crazy in the chairman.
Thank you, sir. Stephen Lee.
I applaud Jeff. I've never met him, but I applaud him both in his call to the public and in what he just said. I think that the hospital and the hospital system, as well as our whole healthcare system, the way it's currently organized of allopathic Rockefeller medicine, that leaves out all other effective treatments. And you've even got allopathic medically approved treatments for COVID that are left out. There is no state of emergency. They're going based on the number of cases. Hey, guess what? It's winter. People get colds, people get the flu. Omicron is no more dangerous than the common cold in its current form. The hospitalization rate is very low, and the majority of the hospitalizations that they have, and I believe that they will have going forward, are going to be vaccine injury cases. And I do not think any way, shape, or form they should be granted a state of emergency, anything that would take any of our freedoms away or give them anything else. If anything, what we should be considering doing, for those who are really aware of this grand conspiracy of the World Economic Forum and how it's being perpetrated as the fraud that COVID was, to put people in fear, we should consider licensing locally clinics, independent doctors, and nurses who refuse to take the vaccine so that we can actually have an alternative healthcare system that works. Not giving people remdesivir and things like that that have been proven to be detrimental to their health and worse than no treatment at all, putting them on ventilators. These are just ridiculous treatments compared to the thousands of doctors and nurses around the world that have done true science but are censored by the mainstream media. We really need a freedom of true science, not the science, in the ability to obtain health care within our county, and we don't have it now. So I strongly urge you to consider any measure in the future to help bring us to that end, but certainly not to give more power to the hospitals. The only problem they have is a staffing shortage of nurses, which was created by the federal government and created by the fact that so many were fired or quit because of the vaccine requirement. Thank you very much.
Thank you, sir. Karen Vanderjack.
Good morning, Supervisor, Chairman Ron Gould, and the rest of you as well. Okay, last week, Karen Vanderjack, Lake Havasu City. 3 of the 5 supervisors did not see the point in the status of state emergency, but yet it's on the agenda again. I don't know how that happened. I know firsthand about staffing shortages. I had my stay in the Havasu Hospital recently. It's real. Seeing blacked out rooms all down the halls, no one even available to answer the call button. But this experience only spurred me into action to investigate and find out how they get themselves into this mess. The hospitals around the country are experiencing 70% increase in revenue as a result of COVID. They receive kickbacks for COVID-related deaths and COVID cases that led to the use of respirators. Now, here's an example from a statement from the CDC, and I'm quoting. He says that the overcount of the coronavirus is, he basically said that, yes, it's real. The overcount of coronavirus is being done. And COVID will show up for just about any sickness with a faulty PCR test. The PCR test cannot isolate the virus and was never intended. Now, the inventor of the PCR test, Carrie B. Mullis, he's the one who stated this, that this month the PCR test can no longer be used to declare someone COVID positive. So that's starting this month. Now, during my hospital stay, I requested ivermectin, which is approved by the NIH, by the way, and they told me they didn't offer it or have it, but they had a wonderful cocktail. and that cocktail included remdesivir. I since found out that the WHO researchers rejected the use of remdesivir for the lack of effectiveness and the damage it caused to the liver and kidney. On July 15, 2021, the Johns Hopkins study confirmed remdesivir's treatment was not associated with improved survival, but was associated with longer hospital stays. I thought we were trying to not have as many people at the hospital. I don't know. Then I found out why it was pushed. I found this. I don't know if you could see this, but this is the CMS website, and at the very bottom, I don't know why it's not showing up, but it's right there if you want to see it, that they have a note to the hospitals. They say you get a 20% add-on if you use remdesivir. They even provide the codes. Can you see it? Right there, 20%. That was hidden inside the website. Obviously, the hospitals have the money to survive with all these illegal and unethical practices. Why is the lack of nurses a problem? Well, they can't be a part of this. Those close to retirement want out of this. New nurses will find something else in nursing rather than to participate in taking risk with patients for unethical practices. Could I finish, Chairman?
Sure.
I only have a couple sentences. These are the Nuremberg Code breaking offenses. The whole issue of the forced injection hanging over them is the cherry on top. If you encourage them to continue with their illegal, unethical practices by declaring a state of emergency, you too will be accountable to the Nuremberg Code. Don't make their job easier when they themselves put themselves in this situation. Thank you.
Thank you, Ben. Jennifer Esposito. And Scotty McClure's on deck.
Thank you, Jennifer Esposito, Kingman. The purpose of government is to protect the liberty of its citizens, not to engage in special interest cronyism for failed, mismanaged nonprofits. This would set a terrible precedent. If you pass this resolution, which you've basically, everyone has admitted, will do nothing to address any staffing shortages, but if you pass this, you've opened a door for every single nonprofit in Mojave County to come down here and demand equal treatment under the law and have you pass a resolution in favor of them. Now, I have a problem with two specific sections in the resolution. First, declaring that there's any kind of a pandemic, when what we have now is an endemic coronavirus. A coronavirus is a cold virus, which has now mutated to be even less deadly than the 99 point whatever survivability rate that we had with the Delta and the Alpha and the previous iterations of it. So we have an ugly lab-created cold virus, but it's endemic. It's not going anywhere, and it's doing what viruses naturally do, which is mutate to be more effective but less deadly, because that's their survival mechanism. We don't need to declare that there's a pandemic. It's over. It's been over for a very, very long time. The other problem that I have with this is that the KRMC or any of the hospitals have failed to state exactly what state or federal relief that they're eligible for that they're currently not receiving. At the last meeting, about the only honest thing I heard come out of it was the fact that this really wasn't about staffing shortages. Had nothing to do with staffing shortages. The goal of this resolution was to try and scare 100 people or more into getting vaccinated. Well, shock of all shocks, the internet has blown up in the last 48 hours because the inventor of mRNA posted something to his Twitter feed for which he got thrown off of Twitter for. It was from a Canadian COVID Alliance, which did an excellent documentary which showed how badly Pfizer distorted the statistics and how the vaccine is really neither safe nor effective nor even legal under the current emergency use authorization. What it does cause is a myriad of health problems, which I've already read to you into the record. So what we have is a failed nonprofit that doesn't pay property taxes because they're tax exempt, with their hand out like a bunch of con artist grifters wanting more money from the state and federal government, and they haven't even identified any money they're not already grifting, because belonging to that health shortages group, they've been in it since May of 2017. This isn't a new emergency. They've been short-staffed for years.
Thank you, ma'am. Scotty McClure.
I don't know how in the hell this got on the agenda again, but Linkfelter got your name on it. Back in 1991, this friend of mine came out from Georgia. She was an RN, worked for Valley View Presbyterian, or not Valley View, excuse me. Worked for the Presbyterian Hospital in LA, Van Nuys area specifically. They paid her 3 times the amount of money for her to move from Georgia to here, to LA. Plus, they paid for her apartment, $650 for an apartment back in 1990. Pretty fancy digs. So what has the government done? What have you guys done? What has anybody, State Ducey, what's he been up to? It's been a problem since then, since 1990 and before. How did we get in that problem in the 1990s when all these churches and LA rich hospitals got in a problem then? They started bringing people from back east out here. So there ain't no emergency. The emergency was created years ago. There is no emergency except to fatten the paychecks of these conglomerates. The one in Warmack is one I'm really pissed about. They have 55 hospitals back east. They also have a collection agency in that same town. I used my VA card to go to the hospital in Warmack the other day, back in May. I'm still fighting them. They won't bill the VA. They're billing me. Oh, it was over $1,000 to check in with my VA card, swipe it. And now they've dropped it down to $300 and sending me a bill. That's the markup. Here's Zahari last week, or on the 21st. Somebody asked him how much this costs. He said the medication was free, but the hospitals charged for administration of the drug. Yeah, that's like them charging me $1,000 to sit there and wait, and I never did get into bed. I ended up in a COVID room, and they kicked me out of there. You don't have COVID, get out. So I went home. Valley View has been great to me. I was supposed to get a CAT scan over a year ago at Warmack. I'm finally getting it next week at the VA in Las Vegas. Because of them stupid asses, the administration and putting you in the hospital, checking in there, I got to hassle them, and then when the emergency room's another hassle to get into. Takes them over an hour to get me a bed, and they never did that. So, fattening these guys' paychecks, there is no emergency.
Thank you, sir. Do we have a list of hospital officials or request to speak forms for them? Or?
No, I think Denise is going to facilitate.
Okay. Denise Burley.
Chairman Gould, members of the board, I have Will McConnell is here and Scott Street. Will McConnell's the CEO of Kingman Regional Medical Center, and Scott Street is the interim CEO with Western Arizona Regional Medical Center. And then we have a number of people on the phone participating via Teams from the outlying communities. So I would like to invite Will McConnell up first to speak, and then if we could bring Scott down, and then we can certainly involve those people on the phone as well.
That'll work.
Okay, thank you.
Supervisor Gould, members of the board, thank you. It's a nice little echo to keep things interesting.
Everybody gets their own theme song today.
That was pretty monotonous for a theme song. So, going back to the last time we were here, the decision was not to pursue a state of emergency because it was deemed that that was not the appropriate course. And what is on the agenda for today is to consider a resolution recognizing at its core the staffing shortage and the impact that that's having on hospitals. Listening to the comments from the public and recognizing the impact that this entire pandemic, that this entire COVID situation, unfortunately, it's causing more derision and divisiveness than it is unity and support. As a county, as a community, ultimately, we are what's left when this fades into the background. Our ability to maintain relationships, our ability to find common ground and work together is what's going to allow us to come out of whatever you want to call it, stronger and with an opportunity to move forward. The resolution does absolutely nothing from a reimbursement standpoint, it does nothing from a revenue standpoint. What it does is recognizes the impact that the hospitals are experiencing while caring for the community. Similar to last week, if the decision is made that that resolution does not pass, so be it. That's part of democracy. That's part of bringing forward issues to debate. Depending on how it's voted, sometimes it's in favor, sometimes it's not. This should not be seen as if the resolution passes, it's a win for hospitals, and if the resolution fails, it's a win for people who are fighting for what they perceive as their right and their freedoms. Whether someone wears a mask or doesn't wear a mask should be a personal choice based on their interpretation of the science, not based on a political position. The whole reason for this conversation is to shed light on it, to provide an opportunity and a forum for discussion, and to ultimately let local government do what local government's supposed to do, and that is find a way to govern a community of disparate individuals with differing opinions that are seeking information from various sources and recognizing that people feel very strongly, especially when they feel that their freedoms are being encroached upon. So I don't envy the position you're in. I'm happy to answer any questions. Ultimately, this is about how we as a community move forward. I came here to be part of a community. I want this community to be vibrant and strong, and that's a function of all of us, regardless of our roles. So, happy to answer any questions.
Questions?
I have a question.
Supervisor Angus.
So last week or 2 weeks ago when you were in front of us about the crisis, I asked you, what would this resolution, declaration, proclamation do for you? Mm-hmm. Is there like more money you can access? And I was told no.
That's correct.
But in this resolution, it says, be further resolved that the Mojave County Board of Supervisors supports and endorses all Mojave County Hospital requests for relief from state and federal agencies to help alleviate the current threat to county citizens.
Yeah, and relief is, so here's the way I read that sentence. That relief has everything to do with when we were trying to make the case of why Mojave County and Kingman Regional Medical Center should get nurses from state and federal governments. Our ability to reference this resolution, our ability to reference a community response to the staffing crisis and others may help us with a better case. Because right now, we are competing against Yuma, against many other locations for that relief and for that aid. So that was the intent of that statement. It was not meant as a financial relief. Right now, the COVID cost centers where we track things with the CARES Act, Who knows if COVID costs will be reimbursed or not? We're not operating under any assumptions that that's happening. So that relief is really about when we're making a case for staffing, that it's recognized that the county also sees that there's a staffing shortage.
Again, that even confuses me a little more because you said that your purpose for this was to let everybody know in the community that there is a crisis. Ginny?
Correct.
And I want everyone to see this. This was an ad that I think all the hospitals put in the 3 major newspapers. Oh, you got it? Thanks. And that was really good. I was happy to see that. I think
Awesome.
that's things that you guys can do. You're welcome to come on my radio show. Let people know. But for government to have a resolution, a proclamation, declaration that there's a crisis when, frankly, a lot of it is here because of government intervention, I just don't think it helps you. I don't think it's necessary. But again, I wish you'd been a little bit more forthcoming about that being, because we knew that was the prime motivation for asking for this, and there's nothing wrong with it. But no one would say that last time, which I felt a little odd. It was more like, no, it's about letting people know that there's a crisis. And
It's all part of that same package.
have you guys gone? I mean, we have Penny Pugh here, who's from Congressman Gosar's office, and she would be the person to go talk to about if there's anything
to imply that we haven't, I appreciate the perspective.
Well, then how could this help you then?
Insulting.
If you've done it already,
Because again, it goes back to my previous statements. Our ability to receive that relief by being able to demonstrate a unified front with the county and the other hospitals helps this county get resources for the staffing shortage. I was clear about that then. That position has not changed.
I don't think so, but that's okay.
Okay, that's
and I'm
fair.
not, I just want to make sure this is what I think it is, right? Because it may seem just like a throwaway resolution, whatever, but nothing goes unnoticed in government. We had this discussion many years ago. Supervisor Bishop might remember about resolutions and what they do. They go down and they want to act on it. And I'm not sure for private hospitals and things like that if we want more government intervention on that. So be careful what you wish for.
I really wish that statement were true, that nothing went unnoticed with government, because I think we'd all be in a very different position right now.
Well, we'll see about that, but thank you very much.
Yeah, absolutely.
Further questions?
Chairman Gould.
Supervisor Lingenfelter.
Thank you. Thank you again for being here.
Absolutely.
Today to discuss this resolution. In reading it, it doesn't say anything about for or against the vaccines. It doesn't say anything about for or against masks, for or against treatments. I share with my colleagues that it's really just a statement. This resolution, it's different than an emergency declaration that you originally were looking for when you approached the county. It's only a statement, but long term, it doesn't really do anything, and everybody agrees on that, right?
It helps in the short term potentially. There's no guarantee.
Sure.
And again, as I mentioned, if it doesn't pass. It doesn't pass. We're still going to take care of everybody like we're supposed to.
Yeah, I agree. And I understand that there's strong feelings on both sides of the aisle, and a lot of the stuff I kind of agree. I think in the last 2 years we've seen sort of an incremental, we've gone towards authoritarianism by like 1,000 little cuts. And I appreciate that, and I think you guys are in a tough spot. I don't know a whole lot about the healthcare industry, but I know my family has some facilities, and your payer mix looks like our payer mix. And the federal mandates, you guys are bound by those. So I understand that's a really hard position to be in. As far as the reso, though, is concerned, as it's written, I can support it, but I want to ask for my vote that you do something else. I want to take the opportunity. I think a lot of the things that we've seen in Mojave County as far as the healthcare services industry are long-term. I think they're industry-wide. I mean, you're more of an expert on that than I am. But, I want to say that I want to take the opportunity to mention to you, all of our hospitals, and to also to Mojave County's healthcare services industry, that I would hope that you would follow in the footsteps of our Mojave County manufacturing industry, which created, they unified and created the Kingman and Mojave Manufacturing Association, otherwise known as CAMA. And the reason they did that is to take on their shared industry issues together with a unified front and voice. I think the same type of sector strategy could really work for our Mojave County rural healthcare services industries as well, to tackle all these long-term issues that you guys are facing. And I think, correct me if I'm wrong, but there's something called the Mojave Health Coalition that's maybe started. I believe that's an attempt at precisely doing something like that. And I think that should be encountered and supported. So for my vote, I'll vote to support this if you can really assure me that the hospitals and our healthcare services industry are going to start to come together in some sort of a sector strategy way. I think that this is a huge opportunity because these things aren't going to go away with just a resolution. They have to bring, all of you together, just like CAMA and the manufacturers came together to solve common industry problems. I mean, that has to be a part of the solution, in my opinion.
Yeah.
Can you agree to that?
So one of the things that I'd like to do, and I don't know if this is the appropriate forum, is introduce you to the Arizona Hospital and Healthcare Association. And right now, that is the forum where these discussions are taking place. It is statewide. Mike Patterson, Scott Street, Feliciano Hiron. There is representation from all institutions in the Arizona Hospital and Healthcare Association. That also includes mental health facilities as well as including long-term care facilities. So right now, that's where those conversations are taking place. So are you looking for something over and above that current structure specific to the county?
Specific to the county, yes. I think that rural healthcare may be a different animal than metro healthcare.
Mm-hmm.
And
I agree with you.
Just like manufacturing in metro areas is different than rural, right? I mean, you have difference in utility rates, you have differences in training programs that are available, all sorts of different things. So what I'm looking for is hopefully some sort of a regional sector strategy. Everybody that's in Mojave, right? Mojave is very diverse. I mean, Havasu is very different than Colorado City and the Strip area, but all still, considered rural.
Yeah.
So I would hope that on a regional level, that you all in the healthcare services industry could come together somehow, sort of like CAMA has, to tackle our regional rural issues. Does that make sense?
I appreciate that. Absolutely. No, that's not an inappropriate request. I mean, getting the healthcare institution together, whether we go at this from the mental health perspective, whether we go at the hospital perspective, I think that's worthwhile. I mean, that's part of the community health needs assessment across the community, across the county as well. So I think we can find a way to do that.
So for my support of this resolution, you can commit to doing that or pushing that?
Well, so I need a clarification on exactly
on a rural
entails.
regional solution.
So starting the conversation is different than creating what you're talking about. If you're asking for me to start the conversation, 100%. Okay. If you're saying your vote is contingent upon that being formed, I cannot speak for the other three hospitals.
No, I think everything great starts by connecting dots. And the way you connect dots is you start a conversation.
Perfect. No problem.
If you can commit to that.
Absolutely.
All right, thank you.
Any other questions? Supervisor Johnson, do you have a question?
None, Mr. Chair.
Thank you.
Thank you.
Mr. Chairman, I believe I was introduced.
Sure, you can proceed.
Okay. I'm Scott Street, the interim CEO at Western Arizona Regional Medical Center. I do appreciate the opportunity to come and speak again. And just to talk to you, I've got notes, but I'm going to probably not use most of them because of the conversation that has occurred in the last 30 minutes or so. I value opinions, and the opinions I've heard in the last 30 minutes are valued tremendously. I think that's the beauty of living in this country. We can be very diverse in our opinions and speak our minds. Today is simply, I think, about education and awareness on both sides. Finding a common ground, as Will said, I think truly is our goal after thinking through the conversations we had a couple of weeks ago prior to the holidays and the conversation we're having today. Supervisor Lingenfelter, I want to note a couple of things you said. First, fully committed. So I'll join Will in his comments to have conversation. Over the holidays, I had an opportunity to be back in my home state in Arkansas, and I am on the governor's task force there to try and figure out a solution to the unfortunate increase, whether it be deemed serious or not, but the increase in COVID, in both in Missouri, Oklahoma, North Texas, and in Arkansas. And do not have a solution at this point, nor do we here by any means. But I think having dialogue like this can bring some solutions to the table as long as we work together. And I think through education and awareness, we can do that. Our hospitals currently here in Arizona are filled with critically ill patients. That's a given this time of year. It has been compounded with COVID, as we spoke to a couple weeks ago. It seems to be on a rise. And I think there is a direct correlation to the holidays. We like being together in holidays. And so as families, and that does, there is I think a direct correlation and proven direct correlation to gatherings and a spike in COVID. Our healthcare workers are extremely stretched thin, and we've talked about that at length this morning. They've given their all to keep patients safe and help them heal during a relentless pandemic for almost 2 years. Some have said 3, so between 2 and 3 years. Hospitals simply want to be there in the event of any emergency, whether it be COVID or non-COVID. We want to be there and be able to serve any of us in this room today that need health care. Simply request the approval of the resolution. And we do appreciate the dialogue and the opportunity to have dialogue. And we can reassure you, I believe, wholeheartedly that we will have, from a healthcare standpoint, communication about how we come together. Wholeheartedly agree that there is a difference from rural and urban settings in how we treat healthcare in general. And so I am very open to having much conversation about that as well. So I appreciate the opportunity. Any quick questions for me?
Questions? Supervisor Johnson?
None, Mr. Chair.
Thank you, Supervisor. Thank you, sir.
Thank you.
Denise, did you have other people that wanted to testify?
Chairman Gould, members of the board, we do have a few people that are participating via Teams, and I'm unsure of who's on the line. I know that Mike Patterson from Havasu Regional Medical Center was planning to attend. And Mike, are you on the line?
Yes, I'm here, Denise.
Great, thank you. I'll leave that to you, please.
Okay. So
proceed.
I won't take a lot of time here. I just do want to echo my support of what Will and Scott have said and reiterate the situation that we are in with our healthcare workers. They have been at this for several years, as has been mentioned. And there is a lack of healthcare resources right now, healthcare workers and their availability, not only the bedside staff, but also the support staff as well. And so I just, again, would echo what has been said and ask your support of the resolution that's in front of you.
Thank you, sir. Questions? Hearing none. Thank you, sir.
I believe we also had representation from Valley View Medical Center. And Feliciano, are you on the phone?
Yes, this is Feliciano Hiron from Valley View Medical Center. and really want to echo Will, Scott, and Mike's discussion points, very much so in that as we come together and are committed to an open dialogue and the resolutions that we want to bring to the table to support our healthcare systems in Mojave County, it's imperative that we come up with the ideas and the dialogue to support one another. And then more importantly, that we have the support of this resolution, because again, these are going to be essential components in going forward and being able to care for those patients in the communities that we're privileged to serve, both in the river valleys and throughout Mojave County. As we go forward, our goal is to be there to support our patients and our communities, support those people that are helping us inside of our healthcare systems, our nurses, our doctors, our frontline staff, to ensure that we're doing the right things for our community, and ensuring in doing so, we're working with those partnerships with those individuals that have come today to talk. Is there any questions from anybody on
questions
from the board?
Hearing none. Thank you, sir.
All right, thank you.
Chairman Gould, members of the board, I'm not certain of the other individuals that are still on the line. There were a total of 6. I don't know if we have Dr. Zeri on the phone. He may have had to leave. He had some patient care. Oh, there he is. Okay. All right. Thank you. Go ahead, Dr. Zeri.
Okay, hold on. Can you hear me?
We can hear you. Proceed.
Thank you, Mr. Chairman. So I'm just going to talk a little about the situation we are in right now, how we reach here, and how we can get out of this situation. Without this, knowing this resolution will not more than a piece of paper in our file. So we are in pandemic for almost 2 years. First year without vaccination, and second year with vaccination. I'm not against the vaccination, but if we have more COVID-related death in second year than as compared to first year without vaccination, healthcare worker wants support of our government to support and stand next to them, not to make this pandemic political situation. This resolution will tell people, like Mr. Bill says before, not a business as usual. So when we send from the hospital patient home, or we delay the surgery or cancel the surgery or delay the care, they know why we are doing that. Also to support our healthcare worker and hospital, to stand next to them, to support them. Now what will be the course of action? Without that, it will be meaningless to pass this resolution. We are trying to get a meeting on January 27 under Mojave Health Coalition, which we started 2 years ago. We are going on January 27 at 5:30 Anderson Fieldhouse to bring all the hospitals, including county supervisor, mayors, office from the congressman and the senator on one table to discuss more. For short-term and long-term goal, after this resolution, what we can do. For the short-term, what we can do, that we can start a quick walk-in clinic to keep people out of the ER, where we don't need to use the RN nurses. We can use nurse practitioner, PA, medical assistant, and LPN, which can be done by all the hospitals in Mojave County to keep people away from the hospital and the ER. Number 2, what we can do, that we can start monoclonal antibody like they're doing in Laughlin and Vegas in the urgent care in the clinic to keep people out of the ER in the hospital, which we are not doing in Mojave County. Other thing that we can request to the primary care physician in Mojave County to please start seeing some extra patients and give us a help 2-3 days to keep the hospital patient out of the hospital. Because what's happening that in last 2 years, the patients are not getting the help and the care they're supposed to get, so they are getting more sick and they go to the ER. So if the primary care physician starts seeing more patients and they don't have to wait for 2-3 months to see a doctor, that will also help the hospital. Other thing we can do that, like Mr. Bill talked last time, that is very hard to send patients back to a skilled nursing facility because of the COVID positive. They need to be quarantined for 2 weeks in the hospital. We can request to the skilled nursing facility in Mojave counties that maybe they can make an extra COVID type of unit, so we can send patients there, so that all the COVID patients should be in the same area, so it don't delay transfer to skilled nursing facility. So we don't have to keep the patient in the hospital for 2 weeks for quarantine. Other thing we can do, like we got $42 million from the county for COVID-related disease last year. Now, I heard many people asking that how the county can help the healthcare system in our county. $35 million signed by the governor last year to supply the nurses, for the contract nurses. At least what we can do that the local government and the county can use that COVID money to the hospital to help them, like governor is helping us. So out of 42 million, maybe we'll get more next year. We can give some support to the hospital to get that nursing staff. Other thing that maybe we can talk with the Arizona legislature to find out if we can put some restriction on a staff agency, because they are charging almost $250 or $200 to hire the RN at the hospital, and this is ridiculous. The long-term plan to take care of this problem is, number one thing, we have to figure out how we reach here, where we are right now, that we have so much crisis to hire the medical staff. Now, it's not really, we can blame 100% to the COVID, but I think it's a lot of problem which we ignored for last few years. Number one, in the hospital, we need more communication with the staff, especially with our nursing staff. Number two, in hospital, we might need to find better leadership so they can communicate with the staff. Number three, the wages in the Mojave County is very low for the healthcare worker. So we need to figure out how we can increase the wages so nurses don't go to Vegas or other places to find the job, and we don't have any nurses to work in Mojave County. Other thing, we need to involve more, the hospital need to involve more with the Mojave Community College, and especially of the training of the healthcare worker, and the more increase in nursing and other healthcare related education. So we should have a more communication in Mojave Community College for the long term, so we have more local people to work in our area. Another very important thing which we are discussing for last few years, but we never did anything for that, is the skilled nursing facility. We have a lot of seniors in Mojave County, and when we admit patients in the hospital, it's very hard to transfer them to a skilled nursing facility because of the lot of rule of regulation from the Medicare and the Medicaid, and also for assisted living. So I think that in the near future, for the long-term plan, when we get all this money from the government for the COVID-related, un-COVID-related, we should think about starting a county-funded assisted nursing facility and assisted living. And this is Ann. Thank you for your time.
Thank you, Doctor. Supervisor Angus.
Chairman Gould. Dr. Ziri, thank you for giving us other suggestions, things that are doable within hospitals and public health. If this resolution included something about perhaps lobbying the government to allow doctors to work with their patients on early therapeutics, such as ivermectin and hydrochloroquine, I could probably get behind that. But as long as we don't treat this early, this is what's going to happen. I don't see the problem really easing up, and you can throw all the money at it you want, but it's not going to ease up. So we have to, as a society, come together But I know that's not in this resolution, but I sure wish it was.
No, I agree with you Ashley, completely, but the problem is not treating COVID early or not early. We are not talking about COVID right now. We are really talking about a shortage of the staff at the hospital.
Right.
And if you can see for last 2 years, the nursing staff and the hospital staff and the doctors are really burned out. They really, some are under depression, some have anxiety. And this is the time we need to stand as a government next to them and support them.
So,
They
Dr.
are
Ziri,
asking just
Dr.
a simple
Ziri,
resolution.
Dr. Ziri, are you saying that Warren C does not have the money to hire more doctors? Is that what you're saying?
Let me tell you a little bit. It's not about Warren. We have a different hospital in Maui County, one by CHS, one by Life Point, and the Kingman is a non-profit. It's not about the money. Right now, it's not about the money. It's about the support from the local government saying that we are with you. That's all. Now, we can sit down anytime you want. All the hospital CEO, chief staff, which I'm doing a meeting on 27th of January to figure out what we do long and short-term plan. But this resolution is nothing more than asking the government to show their support to the local healthcare facility in our town. Forget about COVID for a few days. We are not talking about COVID. We are talking about support from the local government, and we are here to support you. We understand you are burnt out. We understand you need our help, and we are here to help you what you need. In spite of,
But you're saying that. Wait, you're saying that you're thinking that we're here to help you when we can. So when you brought up the ARPA money, again, no one from the hospital has ever approached me about Bullhead City's distribution of ARPA money. Nobody.
How we can approach to you when we are approaching you right now, and you are saying.
But I've already spent the ARPA money. My point is
there are like thousands and thousands of people watching this on the TV and everywhere. And if you're not supporting this resolution, then how you ask us to support next time when we don't get any support? So
I just don't see this as support because it really doesn't say anything. I'm looking for things that actually mean. I said this 2 weeks ago. It's just seems an empty, hollow thing. And now, and I'm getting mixed messages from everybody. You're saying you're not going to use this to go get money, and then there's a bunch of, there's a theory that we're going to use this to tell people that the county wants you to get vaccinated. And, you know how we feel about that too. So it's still and this is just my opinion. I'm just one person. It's still a vague document that doesn't really mean anything. I wish it had more meat to it and said this is what we are going to do. But as it stands now, it could be used for things that, frankly, don't really agree with. And that's why I'm a no vote on this.
Yeah, but let me tell you that this is not about we cannot put everything as a resolution. This is a step 1 to go to step 2 and a step 3 and a step 4. If we cannot pass step 1, how are we going to go to step 2 and 3?
Supervisor Lingenfelter.
Thank you, Chairman Gould. Dr. Ziri, you had mentioned a meeting date in January 2022 of the Mojave Health Coalition. What was that date and location?
On January 27, we will invite everyone, which we're supposed to invite. Anderson Fieldhouse at 5:30.
Okay. Well, I look forward, hopefully this board will receive at least invitation or notice of that. And I do appreciate that you mentioned some regional ideas and solutions earlier in your comments. Really, I think what the large takeaway is with this resolution, I'd like to add to the resolution something about the commitment of all of our hospital CEOs. I want to thank each and every one of you for being here today and for committing to at least starting the regional conversation regarding sector strategy for healthcare services providers and hospitals. I think that's, out of everything, for me, the biggest takeaway for long-term change and long-term solutions for our region, which is all I really care about. If we can add that to this, then I'll vote in favor for it.
Thank you.
Any other questions? Denise, do you have other people that want to testify?
Chairman Gould, I don't know if there's anybody else on the line at this point, so I don't know if you would like to open it up or if you would like to close the conversation.
If there's anybody else on the phone that would like to testify, chime up. Hearing none. Thank you, Denise. What's the pleasure of the board?
Mr. Chairman.
Supervisor.
I'd like to make a motion to approve resolution number 2022-019 with the added tasking public health and the hospitals to add something to the resolution that's the final version. Something about the starting of the regional conversation that has been committed to this morning regarding regional sector strategy for healthcare services providers and hospitals.
You've heard that motion. Is there a second?
I'll second that.
Motion and a second. Any further discussion? Hearing none, all those in favor say aye.
Aye.
Those opposed say nay.
Nay.
And I vote no. With your vote of 3 ayes and 2 nays, you've passed the resolution. Let's take a 5-minute break. I can do that too. If everyone will return to their seats, I'm going to call the meeting back to order. Where's the clerk? Waiting on the clerk. There she is. The clerk will return to her seat. Consent agenda. The following items listed under the consent agenda will be considered as a group and acted upon by one motion with no separate discussion of said items unless a board member requests so. In that event, the item will be removed from the consent agenda for separate discussion and action. Supervisor Bishop, you have any? None? Supervisor Angus?
Item 21.
21. Supervisor Langenfelter?
Nothing today, Chairman Gould.
So I'm looking for a motion to adopt the consent agenda except for item 21.
So moved.
Second.
You've heard that motion. Any further discussion? Hearing none. All those in favor say aye.
Aye.
Mr. Chairman? Mr. Chairman?
Yep. Supervisor Johnson? I can.
I'm sorry, the sound went off on the phone call. Was item 33 pulled?
No, I will pull that for you. Let me restate. So I'm looking for a motion. Since we didn't vote that motion, let's back up. Looking for a motion to adopt the consent agenda except for items 21 and 31. 33. Say again, Supervisor Johnson.
Yes, 33.
For the third time, I will make adopting the consent agenda except for items 21 and 33.
Second.
I think I need a first.
Motion.
Thank you. Second.
Second.
You've heard that motion. Any further discussion? Hearing none. All those in favor say aye.
Aye.
Those opposed say nay. The ayes appear to have it. Do have it. So ordered. Supervisor Angus, item 21.
Thank you. I was wondering if the applicant, Kenny Capitelli, is here? Because my question is for him. He's not here? All right, well, I don't think it's a question you can answer, but. So what I was going to ask Mr. Capitelli, who is not here, when he first came up with the idea to do a river run event with motorcycles at Davis Camp, because it is now a week before a planned Bullhead City event. Bullhead City has worked with a private promoter for years, working on a river run event that grows every year. So it was a little curious that this event came up and it's scheduled for a week before. So I wanted to ask him if he knew that. But that was rhetorical because I know he knows that. And I think it is to have two events like this a week apart. We're talking about, in the backup, it said that there are like motorcycle runs and motorcycle presentations and competitions. And to have two in a row in Bullhead City, I'm not so sure that involves alcohol and I'm not really sure. How does Parks think about that? Was that ever discussed?
Chairman Gould, Supervisor Angus, I was not party to any discussions with the applicant in that regard. I can only glean by the applicant's intent to have a specific event at Davis Camp designed more. Yes, there's live entertainment planned, but there is motorcycle vendors, service vendors, as well as events that are specific at the park, such as demonstrations, etc. That perhaps this is a lead-in to the Bullhead City event, that the applicant is perhaps motivated to tap into a captive audience, an audience that may be compelled to stay for an extended period in the greater Bullhead area to take advantage of then the city event. So that's our overall impression, that this will be an event specific to Davis Camp, where perhaps the Bullhead event would be a more wider range and offer some other.
But there will be motorcycle rides around the streets, because that was, I believe that was in the backup. I can't seem to find
The applicant represents that there'll be a bike show, a motorcycle skills content, and there is a reference to stunt shows, but everything seems to be indicating of it happening at Davis Camp, cordoning off a section of the South Beach parking lot, for example, to have these events. So it seems like it is the intent to capture an event that's wholly at Davis Camp.
Is there a reason, did the applicant tell you he couldn't be here? Is there a reason that he couldn't be here?
Not to my knowledge.
You don't know, no, you didn't hear anything? And after this is voted on, what's the next step that the applicant has to do?
The applicant has to satisfy all the county special event permit requirements, namely coordinating with public safety agencies as well as with risk management, of course, to ensure that their insurance is in place.
You know, I hesitate voting on this until I do have some specific questions just for the applicant. Maybe we could, I mean, would it throw everything off if we just tabled this for 2 weeks? And maybe even if he can't be here, he can at least call in now that we have that capability. We can maybe offer that. Because at this point, there's no reason that somebody could not be here if they had to.
We are exceptionally early with this particular application. In fact,
It's early?
I applaud the applicant coming to us as early as he did. We're only in first meeting in January, and this is an April event. So.
Right. I just have some pointed questions in order to feel good. It's my district.
Absolutely.
So I just want to know about it. So if it's okay with the board, I'd like to make a motion that we continue this item for our next meeting.
Second.
You've heard that motion. Any further discussion? Hearing none, all those in favor say aye.
Aye.
Those opposed say nay. The ayes appear to have it. Motion passed. Let's see. And item 33, Supervisor Johnson.
Thank you, Mr. Chairman. My question is, this is going to be funded through the $5 million grant to begin with, correct?
Supervisor Johnson, that's correct. This is Captain Bischoff with the Sheriff's Office.
And then when that grant, because that grant's supposed to be used for a building and everything else, where's the money coming from?
So yes, the $5 million that was originally received has been parsed out. There's a large portion of it for a building facility, and a smaller portion has been carved out for staffing and office work.
So you'll be coming back looking for more funding for staffing when that runs out?
I think our goal is to continue searching out new revenue sources to continue the program as this moves along.
Chairman Gould?
Supervisor Angus.
Supervisor Johnson, I believe that we will be receiving more grant money for this. It has been, again, nothing is guaranteed in life, but there's a lot of money for this kind of re-entry. It's the wave of the future. I know most of the law enforcement agencies in Phoenix are very proactive in advocating for it. So we expect to be amongst the first to get monies as they become available. In fact, we've been sort of promised the next round of of something that came up at the state, and I'll be speaking to our Representative Cobb this week about that. And I could come back and report on that at next meeting.
Oh, go ahead, sorry.
I was just going to say,
Supervisor Bishop.
Chairman Gold, as a member of the ACJC, I'll be supporting further grants as the years progress, and also lobbying with our legislators to continue to support this program.
Any further discussion?
None, Mr. Chair. If it's going to be funded by grants, I have no problem.
What's the pleasure of the board?
Chairman Gold, I'll make a motion to approve.
You've heard that motion. Is there any further discussion? Hearing none, all those in favor say aye.
Aye.
Aye. Those opposed say nay. The ayes appear to have it. I guess I got something else to do. Public hearing. Item 35. Move my giant stack of paperwork there. I'm going to open the public hearing. Ted Martin. Hello, Chief.
Good morning. Happy New Year.
Happy New Year.
I'm glad to see everybody's here with their smiling face on. So, on behalf of the Mojave Valley Fire Department and myself as a citizen, we support the approval of this helipad. One of the reasons that it's important to us in being able to provide service is there is no alternative traffic route between Courtright and Boundary Cone along Highway 95. So if there's an incident on Highway 95, DPS is a little hesitant to close down the highway to land a helicopter because they want to keep traffic moving, and that creates a hazard. The district also has 6 other designated spots within the district that we have pre-designated to land helicopters. So adding this one as a tool would be beneficial. And I'll just say, right before the Thanksgiving holiday, we had an incident at Boundary Cone and Highway 95. That traffic became an issue, and being able to move traffic and get them to avoid the area, and it became a problem, trying to direct traffic and move that traffic, and then they were actually driving through the accident scene because it's just hard to manage. So being able to have an extra tool like this, Mojave Valley Fire Department supports that and looks for your approval on granting the special use permit. So unless you have any questions for me.
Questions for Chief Martin? Hearing none. Thank you, sir.
Thank you. Happy New Year again.
Joseph Jones.
I'm the applicant on the helipad in Mojave Valley, and I'm just here to answer any questions that you might have.
Questions for the applicant? Hearing none. Thank you, sir.
Thank you.
Anyone else care to testify on this item? Hearing none, I'm going to close the public hearing. What's the pleasure of the board?
Chairman Gould, I make a motion that we approve item 35.
Second.
Second.
You've heard that motion. Any further discussion? Hearing none, all those in favor say aye.
Aye.
Those opposed say nay. The ayes appear to have it. Item 36. I'm going to open the public hearing on item 36. Anyone care to testify? Hearing none, I'm going to close the public hearing.
Chairman Gold, motion to approve.
Second.
You've heard that motion and second. All those in favor say aye.
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 Those opposed say nay. The ayes appear to have it. Do have it. So ordered. Item 37. I'm going to open the public hearing on item 37. Anyone care to testify on item 37? Hearing none, I'm going to close the public hearing. What's the pleasure of the board?
Chairman Gold, motion to approve.
Second.
You've heard that motion. Any further discussion? Hearing none, all those in favor say aye.
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 Those opposed say nay. The ayes appear to have it. Item 38, I'm going to open the public hearing on item 38. Anyone care to testify on the item 38? Hearing none, I'm going to close the public hearing. Pleasure of the board.
Mr. Chairman,
Supervisor Lingenfelter.
motion to approve the U.S. Resolution number 2022-008.
I second that.
Motion and second. Any further discussion? Hearing none, all those in favor say aye.
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 Those opposed say nay. The ayes appear to have it. Item 39, I'm going to open the public hearing on item 39. Anyone care to testify on item 39? Hearing none, I'm going to close the public hearing. Pleasure of the board.
Mr. Chairman,
Supervisor Lingenfelter.
motion to approve the adoption of resolution number 2022-009.
Is there a second?
Second.
You've heard that motion and second. Any further discussion? Hearing none, all those in favor say aye.
Aye.
Those opposed say nay. The ayes appear to have it. Regular agenda, item 40. Tammy, you want to come on up?
Thank you, Chairman Gould, Supervisors. Do you have any questions, or do you want me to do an overview, or what would you like?
Why don't you give us an overview?
Okay, this is the Good Jobs Challenge through the EDA grant. It is a minimum of $1 million that you can ask for, up to $25 million, with only 50 grants at the max that they're going to give out. And so it's very, very competitive. We're working with Mojave Community College, as well as Arizona State University in Lake Havasu, so that we're having our regional approach but mostly within our county. And the two departments within the county to apply for this grant is going to be the Economic Development Department and Community Services. The purpose of the grant is for employers, not for us. So it's an employer-driven grant that the employers are going to let us know what their needs are for workforce. Specifically right now, finding workforce, as we know, is very difficult. And so we've met with several of the employers within the county already. We have talked to them, and the three, maybe four areas, but the three areas we're focusing on, which is evident today, we need trained workforce in healthcare. Manufacturing and transportation will be the second. The third one is construction, and we were going to have 4 of tourism and culinary, but after meeting with our grant consultant that's going to overview the grant, we met with her on Thursday last week. She felt that the jobs would not pay enough through the tourism and suggested that we focus on the other 3 industries and then use the same approach with our tourism, with our call centers and with everything else that we need. Use the same approach, but not use the grant specifically for that. So at this point, we're looking to withdraw. It is a 100% match grant, which is very important, but they are looking for, and it talks about that within the grant, they're looking for specifically what our community is willing to do to support that. So in that, the part of this, we're asking that maybe the county could help support with cubicle space and computers and transportation as that part of the grant. The employees that we end up hiring will be paid for through the grant itself, not through the county. The college is going to have some match. The employers are going to have match. And it may not be funding, it may be hours that they're contributing, but there will be some match that will show in that in the grant. So any questions?
Questions for Tammy?
Chairman Gould.
Supervisor Lingenfelter.
Thank you. Tammy, is there a total grant amount that
you'll be applying for?
We don't have that yet. We're getting close, but it'll be between 7 and 10 million.
7 and 10. And did I hear you correctly that one of the main goals of this grant will be to work with targeted industries? The community college is the primary workforce trainer to create new talent pipelines, or
That's exactly right. That's exactly right. We'll start, the actual part of the training of the grant is on year 3, but we want to start as early as within 6 months of receiving the grant to have that pipeline start with the lower paying jobs and increase throughout the time of the grant. The other thing that I didn't talk about was the region, and we're including the regional areas outside of Mojave County, Needles, Laughlin, Mesquite, Hilldale, Apple Valley, because we all have the same workforce. We're all the same people. And so we're trying to include everyone in this grant. And that's important. This is not just a county grant. We wouldn't get it if it was. It has to be regional. So when you talk to the grant consultant, she said, we've got one little glitch that we've got to get through, and I will contact all of our region is within the Seattle area, except our little few areas in Utah, which is in the Denver region for the EDA. And so I've got to contact them and let them know what we're doing and get their support.
Got it. Do you have to get letters of support from the private industry partners?
We are in the process of doing that already, and we've already have a few.
Well, hopefully, on the last item that we talked about with the resolution, they've committed now to starting a regional sector strategy solution. So hopefully that they'll be a part of that.
And that's what we'll meet with them. We've already met with some within the health industry, but not them specifically. So.
Well, we need to hold them to their commitment. So.
We will.
Chairman Gold.
Mr. Chair. Oh.
Senator or Supervisor Bishop. Everybody's a senator today.
Okay, never been a senator.
There you go.
Don't plan to do so, but I just wanted to say that I've attended several of these organizational meetings where these ideas were discussed, and I agree, finding a trained workforce in this region and, of course, in the nation has become a crisis. So if this grant was received, it would provide funding to create programs that will decrease the gaps for the underserved, and I'm really interested in that, as well as affordable housing. So you've got my attention, and I think with this employer-driven grant specifically to get people trained within 2 or 3 years, and they're going to be making more money than they could make now without this training. So I am definitely in support of this, and if it's going to cost us a little bit of office space, I think we can afford that. So thank you for all of your work and for Michael Smith's work on this.
Thank you.
Supervisor Johnson.
Thank you, Mr. Chair. Can you explain what kind of training you're going to be doing? We just got an overview of how great everything's going to be. Just what kind of training can people expect?
Oh, I think I understood you correctly. Are you asking the type of training that we're going to put into the grant?
Yes, we're talking about getting millions of dollars, and we're going to train these people, and they're going to get more money.
Right.
What kind of training are these people getting?
So some of the training has not been determined yet because it's the employers that are dictating that to us. With the Advanced Manufacturing Training Center that the college is going to be building within the next couple of years, some of the funding can go towards equipment to help, but it's going to be for manufacturing and construction. Some of those trainings are the same, so it might be CNC or I don't have it in front of me, welding or all of those things are the same processes, same training for a lot of it, but it can be applied to whether it's manufacturing or construction. Healthcare specifically, we need to find out what their needs are and what we can do to help support that. There's already a nursing program through the college as well as the university, and we felt that was a really good match to support both of them with the grant.
So we're getting nothing new. We just have we have welding classes now. We've set up truck driving classes. We have nursing. We're getting nothing new.
No, we'll be getting new programs. I just don't have that list in front of me. I know that some of the programs that we need right now are going to be like AutoCAD that we don't have training for. Can you think of anything else? The apprenticeship programs is one that the college is working with, and the county's working with the college. And so we're in the process, and that is another one that's led directly by the employers. And so they're letting us know what their needs are. So no, I don't have that list completely in front of me yet, but we will have that list probably by the end of, probably 2 or 3 weeks. We'll have a good solid list of what that's going to look like. The EDA, thank goodness, last week extended this grant to February 10th, so that gives us a little bit longer to work on it.
So we're asking the board to approve applying for a grant, and we really don't know how it's going to benefit anybody different than what it does today.
No, I think there's going to be a lot of new programs that are going to be created. We just have to figure out what the employer needs are before we can create that.
That's all, Mr. Chair. Thank you.
Any further questions?
Chairman Gould.
Supervisor Lingenfelter.
Thank you. I'm glad to hear you mentioned the new 20,000 square foot advanced manufacturing training center that's going to be built by the college. They've told me that they expect that to be operational maybe mid 2023. Is that correct?
That's correct.
And I know they've done a lot of work for that facility, and as far as the curriculum that they're going to be holding in that facility, from high school to all the way to ongoing training, workforce development for the adults and things like that. So I think that's good, but I think you got a lot more work to do in the healthcare services industry, obviously.
The next 3 or 4 weeks will be
Will the final grant, to Supervisor Johnson's point, will it shed a little bit more light on the curriculum and some of the outcomes that we hope to receive? I'm sure the EDA is going to want to know.
That will all be in the grant, so yes, we can show that at a later date.
Okay, thank
and
you.
We'll be needing to work with some of the reentry program is going to be huge with part of what we're doing, and so we'll need to get information from a lot of you as well as our employers.
Yeah. I know Dr. Lacey, who's the college's dean of workforce. He's from Montana. He was the state's, I think, top guy for apprenticeship programs at one point. So hopefully he'll lend his expertise to what you're doing.
We've been working strongly with him, probably for 6 months on the apprenticeship program, so we will continue.
Thank you.
Thank you.
Any other questions for Tammy? Thank you, Tammy.
Thank you.
What's the pleasure of the board?
Chairman Johnson, Chairman Senator Gould.
Supervisor Bishop.
I would like to make a motion to approve item number 40, A, B, and C.
Second.
You've heard that motion and second. Any further discussion? Hearing none, all those in favor say aye.
Aye.
Those opposed say nay. The ayes appear to have it. Let's see, item 41. Is that your item, Supervisor Lingenfelter?
Yes, Chairman Johnson, or Chairman Gould, excuse me. I'd like to ask Steve to come up. I've been working with Public Works staff, County Manager's Office, also the Centennial Park Domestic Water Improvement District for the better half of last year, since probably May. The situation up there, as you probably know, they've gone through and continue to go through a pretty dramatic shift in Centennial Park, Colorado City. There's a brewery up there now. There's a new winery. Tourism is really ramping up. There's a series of 3 mortgage or office buildings that are going in up there. Very large, probably the nicest grocery store I've ever been in. The Bees Marketplace up there, off the state route. In Centennial Park, they're at a point when they can't really grow anymore because of water limitations. They don't have the water to grow. As far as the technical aspects of this project, I'd like to ask Steve just to give a general overview of the project, if he would.
Thank you. Chairman Gould, Supervisor Lingenfelter, this project will deliver for the Centennial Park Domestic Water District a new production well. The district back in October completed a hydrogeological study which identified a probable and recommended site for a new well, and that would be within the improvement district itself. This project will deliver a kind of a 3-phased approach. One, a pilot well that will be drilled for the purpose of ascertaining that the water quality is in fact satisfactory, as well as other performance capabilities of the particular site. And then it would move, with success in the pilot phase, it would move toward well drilling, and then secondly, well equipping. So all the phases will be administered, procured by the district. This funding agreement that is before the board for consideration would be such that it would provide a reimbursement type approach where the district would remit invoices to be paid from qualifying contracts for the production well development, and Public Works as administrator would verify that those invoices are for qualifying work, and through the agreement would pay back the appropriation of the ARPA funds being sought under District 1.
Thank you, Steve.
Any further questions for Mr. Latosky?
I just have a question. Is this the being funded with the first round of ARPA funds or the second round?
Supervisor
I can
Bishop,
answer that
perhaps,
question.
yeah.
This is being funded with the first half, the fiscal year 2022 allocation of ARPA funds for District 1.
Okay, thank you.
And in closing, I would say if any of you that have been up to Centennial Park, some of the nicest homes in all of Mojave County, really, this new well is really going to enable that portion of the county to do some additional economic development, some additional commercial development, some additional residential development, and new property taxes, which is always a good thing. So, thank you.
Any further discussion?
Mr. Chairman.
Supervisor Langenfelter.
Excuse me. Motion to approve item 41.
Second.
You've heard that motion in second. Any further discussion? Hearing none, all those in favor say aye.
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 Those opposed say nay. The ayes appear to have it. Item 42, Supervisor Angus.
Thank you. We brought this back again. It's about the Emergency Rental Assistance Program money to the tune of $5.1 million. Just a little history. We approved one back. What year? Mike, can you come up here? What month did we do ERAP 1? That was about last
I believe that was
February?
March.
February, March. And at the time, it was kind of slow going, we thought. By April, May, June, by July or August, September, we'd only used about half of it, people. So this is money that people apply for rental assistance, utility assistance, if they have been affected by COVID. And then another 5.1 million was brought up to the board. And at the time, I said, well, we haven't even used the first allocation. Why do we need this? And, we have our own sort of ideas about whether people should rely on all their basic human needs by the government. There was a philosophical over it all on whether or not to accept this. And then, bing, bang, boom, all of the other money got used, which again, I know, thank you, you gave some backup information about where it went. I still have some heartburn about how they figure out if it really is COVID related. But then something happened, and that was called vaccine mandates. And we heard a lot of people that were leaving their job or were fired because they refused to take this vaccine. So I asked Michael if this money can be accessed by people who have lost their jobs or are thinking of leaving their jobs because they do not want to get vaccinated, that this would help them. And we were told that, yes, this could be used for that. And that's the good news. The bad news is we were told that in the context of, they don't really check anything. It's self-attestation, which is, if you say it was COVID related, they're going to take your word for it. And that also gives me a lot of heartburn about that too. So I'm very torn about this. However, I did speak to my city and some other people who were in it, and is there any way, I'm going to propose that we approve this, but is there any way we can get a presentation or have somebody from DES come so we can ask some pointed questions or maybe some samples of the application process? Because I have some issues with that.
Supervisor Gold, Chairman Gold, Supervisor Angus, definitely could ask the state to do that. They've always been very forthright and helpful through the process of this grant. And sure, we could look into that. Yeah. Also, the application, just to be as transparent as well, the application is online. So, I mean, if you wanted, that's something that we probably could pull up and go through anytime as well.
Right, but my real question is, how did they check up if the application is true? And the answer is they don't.
So they do some verification because there is a process that DES has in place to verify this. This is a federally run program, so the documents have to be provided, and they do check those documents. And when something does come up, they do have a fraud agency that looks into it. We actually had a letter delivered to our office in regards to somebody that thought somebody might have been skirting the system. We forwarded that on the DES, and they said they definitely would look into that. So they do.
Do you know what happened with that?
That happened, I want to say 2 or 3 weeks ago. I haven't been informed of anything of that yet.
So there is an avenue, a mechanism for fraud and stuff like that.
Well, they have to go through the process, and they have to provide the proper documents to receive services. It's just not, here, fill this out, and then there you go. They do have to go through the process of any application, like we would with any of our housing programs or any of our WIOA programs. They would still have to go through a process.
Is there any way I could see that if names are redacted?
What exactly?
To see what kinds of things people are putting on applications, because I'm nosy.
Chairman Gold, Supervisor Angus, I definitely could see if there's a report or something that we could do in regards to how people are affected. That could be a good question, and the state probably could provide us some of that information. So, did the people lose their job? Are they on UI? How were they affected by COVID? They might have a tracking mechanism for that, and we could definitely look into it.
And so I did speak to the city manager of Bullhead City, and he has similar concerns, although he believes that it has helped tremendously. Our city was the #1 getter of some of this money, of a lot of this money, even though it really started evening out at the end there. And he said that a lot of people do come to the city, and they have a designated person who helps them do that kind of thing. So he believed that the pros outweighed the cons, and that was what was asked of me. Thank you.
Further questions for Mr. Smith?
Chairman Gould.
Supervisor Langenfelter.
Thank you. Mr. Smith, you mentioned in some of the backup, and I don't have it right now in front of me, but the qualifying income. Do you know what that is off the top of your head now?
Sure, it's 80%.
As far as a monetary figure, what is it per year?
Sorry?
As far as a monetary figure, an annual salary, I mean, is it mid-40s or?
So it's 80% of area median income. I don't have the table.
I saw a number that you sent out to everybody. Do you remember what that number is? I remember it being like $45,000 or something like that. But I thought
Chairman Gold, Supervisor Lincolnfelter. So when you look at it, right, it's based upon the household. So the first one, what I believe, is right around $31,000, 80% of area minimum income, and then for every additional person, it goes up, with increments.
Okay. So I look at that, and then I look at there's a lot of employers. Actually, the vast majority of our employers in Mojave County are firms, businesses that have under 100 employees. And they're all having, a lot of them, not all, sorry, you can't ever say all. A lot of them are having some employee issues, right? Staffing shortages. So I have a hard time scoring with that. We have jobs available in industries, restaurants, service industry, other places out in the manufacturers that are having shorting crisis, right? They're having problems getting employees. And the wage looks, for a single person, It's not the highest, but it's certainly not poverty. Who's using these services? Who's using this money?
DES is running this program, so I couldn't put my finger exactly on that same question Supervisor Angus had, and like I said, I could look into that, but I don't have that data to be able to provide it.
Thank you.
Mr. Smith, I saw that the limit was $3,500 a month.
That is correct.
I find it hard to believe that somebody that would qualify for this program would need $3,500 a month, even though our rents were somewhat inflated at the time. That just seems extremely high.
Chairman Gold, that's a great observation there. And so when you look at the way DES set this up, DES didn't set this up just for Mojave County. DES set this up for the whole entire state. So there could be other parts of Maricopa or other parts of the county, not the county, but the state, that would have higher rents.
I don't think anybody in Paradise Valley is under the income limit, though.
I couldn't say so.
It's rhetorical. Any further questions for Mr. Smith? What's the pleasure of the board?
Chairman Gold, I'll make the motion to approve.
Supervisor Bishop.
Make a motion to approve resolution number 2021-237.
Is there a second?
Second.
You've heard that motion in second. Any further discussion? Hearing none, all those in favor say aye.
Aye.
Those opposed say nay. I vote nay. Count.
Motion carries 3-2.
With your vote of three ayes and 2 nays, you've given a affirmative to item number 42. We've already done 43. Item 44, Supervisor Johnson.
Thank you, Mr. Chairman. I would make a motion to reconsider item 19 from the December 20th, 2021 meeting.
What is item 14?
19.
19. From the 12/20 meeting?
12/20/21, yes, sir.
2021. What was that item?
It was approve the Parks Administrator to apply for and sign necessary permit and license applications to operate and manage Mojave County Fairgrounds, including health permits for fairgrounds, kitchen concessions, use, music licenses, etc. The reason I'm looking for a reconsideration is we're putting the liquor license under the Parks Director. When we had a liquor license before for the county, it's in the County Board of Supervisors or the county's name, and I believe we've handled it through the clerk before, and it gives us more control over a license that we're responsible for if it goes back to the clerk.
Thank you, Supervisor. I didn't see the word reconsideration. That's over a little farther on there. Is there a second?
Second.
Motion and a second. You've heard that motion. Any further discussion? Hearing none, all those in favor say aye.
Aye.
Motion passes. Supervisor Johnson.
Thank you, Mr. Chair. I would make a motion that we approve item 19 with the exception of the Arizona liquor license, and we put that underneath the clerk of the board for board approvals.
Is there a second?
Second.
You've heard that motion and second. Any further discussion? Hearing none, all those in favor say aye.
Aye.
Those opposed say nay. The ayes appear to have it. Do have it. So ordered. Item 45, Supervisor Johnson.
Thank you, Mr. Chairman. I brought this back. Supervisor Angus had questions and asked for staff to bring it back, and we hadn't got it back, so I placed it back on the agenda for answers for Supervisor Angus.
Thank you, Supervisor. We've got a couple people signed up to speak to that. Mehdi Arzami.
Chairman Gold, Supervisors, Happy New Year.
Happy New Year.
My name is Mehdi Arzami from Fort Mojave area. I read the article that was published in Lake Havasu, so I basically prepare the report to basically let you know what is the Mojave Valley Community Park, in terms of the maintenance, what do we have under the scope of the maintenance. Mojave Valley Community Park consists of 2 soccer football fields, 4 softball, baseball fields, and 1 practice cage for softball, baseball, 4 pickleball courts, 1 tennis court, 1 large playground for kids, 1 large handicapped ADA playground, 80% complete, which will be completed in a week or 2. Most definitely would be the largest ADA playground in Mojave County. I don't know about the state. 9 to 18 basket frisbee golf, 1.7 miles of sidewalk, 4 acres of dog park divided into 2 weight group for the dogs, largest dog and the smaller dogs. And I think it is the largest dog park in the state of Arizona. So this consists that 39 acre that we have in Mojave. The uniqueness about the Mojave Valley Community Park, as some of you would know, it's a true community park. It is built by the community, majority of it. That's according to one of the members of the Phoenix Board of Legacy. They appraised it over $20 million right now, and we have received about $1.5 million so far to do that. So a majority of the rest is being done by the community, and I know Supervisor Gold, Angus, you've been there many times on the different grand opening, and I know that Supervisor Bishop stopped by on that. We have different functions on that one. Facilities that we have in there, it's a brand new well and pump recently installed. We are waiting for Mojave Electric Co-op to power it up. 30 feet by 30 feet garage for the miscellaneous inventory we have. And 4 Connex, storage for teams and leagues when they visit us. 1 large restroom facility, porta potties when there is a tournament, and also for day-to-day basis. A 12 feet by 60 feet trailer being used for storage at this time, and over 500 trees in the 39 acre park. So these are basically what we have, at the park to take care of. If I may ask you, Matt Hanrahan is in charge of the activities, and he couldn't make it today because we have another community project, which maybe Boys and Girls Club. We are doing the sodding of 75,000. May I continue? Continue. 75,000 square feet sod we received just before holiday, and we were working on the 30th, which was Thursday, Friday, and then Sunday, and right now out there continuing working. So they sent me over. So if you don't mind, I'm going to read his email to you.
Proceed.
Thank you. He addressed it to me. Mehdi, Monday we are making one last big push to finish the field. I have all my landscaping and pool employees going, and I need to attend. I will not be able to make the supervisors meeting, although I know how important it is. Here is the information that I would have provided. Groups using the park over the last 18 months include Pop Warner's football and cheer 200 youth, Little League practices 250 youth, Triple Crown sports travel, baseball, and softball for tournaments with over 2,000 people attending, Empire Sports travel, baseball, and softball 5 tournaments, over 3,000 attendees, Las Vegas flag football, 1 tournament, 600 youth, over 2,000 people attending, First Responders Picnic and Rotary Cornhole tournament, total of 700 people attending, which I know Supervisor Angus participated in the past 3-4 years, and yourself as well. So that is basically to say our community appreciation to all the first responders of our community, including Needles, Fort Mojave, Mojave Valley, Bullhead City, Laughlin, and all that are inclusive of that one. We have the Adrian Empire has used it twice in the last year. We also have recently established a better connection with the Little League program, and they do plan on using the fields more regularly for games as soon as we can get better lighting. They're fully on board for the future. And also mentioned about, the Frisbee golf tournament and the pickleball tournament that's going on. So definitely the park is being used for the community. And even in the past year, because of the COVID-19 and the state of Nevada and the state of California on lockdown, a lot of those tournaments were transferred to our area, which they use our facility, which, yes, I understand that, we are paying for it. But at the same time, the benefit to our local teams, school and local team, is that they are participating in a tournament free of charge. So instead of traveling to go get, experience of the leagues, as these tournaments are coming in, they're using. And on those, we focus on it. And of course, that, when there is a tournament with 200, 300, 400 people, definitely needs to have additional maintenance that needs to be done, and we do that. So just want to make sure that, for you to know that, we are doing our best. It's always improving, and we continue to move forward. And it's not only myself or, Chip Sherrill or anything like that. It is the whole community right now behind this park to make it better for the people of the Fort Mojave, Mojave Valley, and even the neighboring areas like Golden Shores, Bullhead City, and all that they use, and they enjoy it. And I have Juan Sanchez here, who is the head of the maintenance, available, so he can also address the board, to you and explain the program that we have for the maintenance. Okay. If there is any question for me.
Any questions for Mr. Azarmi?
I have a question.
Supervisor Angus.
Over the years, I've kind of lost track of who pays for what. Originally, River Valley School, but they still use the field, but they do not pay anything.
They don't pay cash, but they contribute to the maintenance because, the ABM, who is basically the maintenance that they use, they help anytime that, there's a need, we approach them. And again, remember one thing, before we drill this well, we are using their well. And they pay for, the maintenance of the well and all that. So they are contributing for the water that we need for the park up to this new well that we have. And again, the reason that, we insisted having a well, because anytime that the high school well would go down, especially in the summertime, it would take 2 weeks to, maintain it or repair it. There would be a major cost on the water. So they are part of our, team that we are using. Obviously, and again, the community is using it and helping, and also we use the budget that we receive from the Mojave County.
And who employs your maintenance worker? Who is he employed?
We have a licensed, bonded, and insured contractor, which is...
And that's paid through?
We use the budget that you have, and then whatever we have is the fundraising that we have for the Mojave Valley Community Park. And again, I can tell you that, there's a lot of, like, for example, Pop Warner or Little League and all that, they understand that this is a community park, and they do like a self-policing, self-governing type of a thing. They look after the park. There's a pride of ownership there. Give you an example, Coach, excuse me, coach of River Valley football team, he is always bringing his team to basically help us with even the maintenance of the dog park, because they recognize that there are elderly people with dogs and they cannot, clean up, as much. So basically it's a community joint venture to get it taken care of.
Okay. One more question. Mr. Latowski, how does the maintenance budget for this park compare to the other community parks in Mojave County?
Chairman Gould, Supervisor Angus, as of May of 2020, the board approved a new agreement with Mojave Valley Community Park to provide, over a course of 5 years, $50,000 annually. Speaking from memory, as it compares to the other community park budget, we actually have a separate standalone budget for the 4 community parks. I recall that budget is roughly about $100,000 annually, and that does pay for a dedicated facility grounds worker as well as the supplies and services to those parks. So for sake of pure estimation, I would say it compares, we're probably spending about $25,000 per year per community park. That would be exclusive of a few of the great grants and upgrades that we've been able to bring to the park the last couple of years.
Right, you've gotten grants. Mr. Zarman, do you get grants? Does the organization, the 501c3, do they get grants for the park as well?
Legacy Foundation has been very great with us. Like, for example, when we did the lighting for the park, they gave us $95,000, but Musco, which was the installers and all that, their proposal was about $2.2 million. So with $95,000 and help of the community, and also, a Mojave Electric Co-op employees that they voluntarily showed up on their own time on a Saturday, we were able to establish the lighting that was worth $2.2 million for $95,000. So a lot of items on this park is, as I mentioned, the retail value according to the Legacy Foundation is over $20 million. We expand every dollar that we get into, larger amount.
Okay. Well, I think it's a great park. I do. I've always had a little bit of an issue because it started out one way and it kind of morphed into something else. And, I think we have talked about that enough. I just wanted to make sure that the money is, somewhat in the ballpark of what we give to the other community parks. But it is much larger. It's a much different kind of park. And thank you for coming here today.
I appreciate that. And again, we provide all the documents to, Director Latosky in terms of how the money is being spent, and the money that we are spending, it definitely exceeds the $50,000 that we are receiving, and that is provided, all the documents, just like anything else, to Director Latosky and his department.
Okay, thank you.
My pleasure.
Any other questions for Mr. Arzami? Thank you, sir.
Thank you.
Juan Sanchez.
Good morning.
Morning.
My name is Juan Sanchez. I live in Mojave Valley. I'm in charge of the maintenance of the park. We do weekly mowing, tree maintenance, maintaining all the irrigation system, and making sure everything's ready for tournaments, and weekly practice of the football teams, and Little League, and maintaining the bathrooms, and making sure everything's secure. Just here to see if you guys have any questions for me.
Sure. Any questions for Mr. Sanchez? Hearing none. Thank you, sir.
All right, sir. Thanks.
Supervisor Johnson.
Thank you, Mr. Chair. Supervisor Angus is satisfied. The only other question I would have, Mr. Latowski, do we have all the reports in like we had asked for last time?
Chairman Gould, Supervisor Angus, or Supervisor Johnson, every June, in advance of our $50,000 payment, we do ask for 2 reports: the invoices that were paid utilizing the $50,000 that would be reimbursed, as well as an operations report. We did receive the invoice, the detailed report of invoices, and we carefully looked over that and made sure that they were for eligible expenses. I do not believe we received the operations report, though, for the past fiscal year. That would be as of June 2021, which details, just the various activities that have been going on, much to what Mr. Arzami has just discussed during his testimony.
Thank you. I guess that's one of my concerns. We're giving out $50,000 worth of money, and we're not receiving the small little request that we made to get those. That's all, Mr. Chair.
Thank you, Supervisor.
May I follow up on that, Chairman Gould?
Supervisor Angus.
Mr. Zarmi, is there a reason why the report wasn't filed in time or ever?
I believe that there was just negligence from our side because, we didn't pay attention that would report what I just mentioned to you in terms of the activities. I thought that it was just regarding the maintenance, and the invoices that we provided to the Director Letosky was about expenses to justify the $50,000 receipt from the Mojave County. So that report, we have, as you noticed, we have a very good log sheet of all the activities that we have at the park, and that can be narrated and send it to you right away.
Oh, I just want to make sure that the reports that the parks need come in.
Yeah,
Because that is what I think Supervisor Johnson is
absolutely.
talking
It's available as I read it to you on a kind of a footnote type of a thing. But definitely I'll make it sure as a report. And again, I was not aware that was part of it, and that was my negligence.
So you didn't know that was report. So now
that
you
was-
know, it will be.
Of course, absolutely. We have all the document, we have all the log sheet. It's just a matter of type it up and send it in a form of a report to Mr. Letosky and share it with the board.
Okay, thank you.
My pleasure.
Thank you, sir. Item 46, Supervisor Angus.
Yeah, this is just sort of the last bit of our District 2 allocation of the American Rescue Plan Act, and that wanted it to go to land that we lease, the BLM land in Bullhead City, adjacent to Highland Road, to make some needed improvements to the BMX track that is doing gangbusters, actually, in Bullhead City, looking to expand, bringing in championship competitions, all good for Bullhead City and the county in general. We brought together Bullhead City. They're going to be helping out too. So this is a really, I believe, great project that is going to improve land that we ultimately own. And I'm asking for approval today.
Is that a motion?
Yeah, so make a motion that we approve item 46.
Second. Or is there a second?
Second.
You heard that motion and second. Any further discussion? Hearing those, all those in favor say aye.
Aye.
Those opposed say nay. The ayes appear to have it. Do have it. So ordered. That concludes our agenda. Yeah, I know. I either got to do the whole thing or...